Hello and welcome everyone to this webinar series and Shanti at this side. And today's very interesting topic which we are going to discuss about is all about dyslipidemia. As we know, this is one of the very critical indicator and it poses the silent cardiac risk. Yes. And joining us for this discussion, I now welcome our expertise, none other Dr. Shabhrinath Garu, who is our senior consultant intensivist from Malakpet Yashoda unit. I welcome you, Dr. Shabhrinath.
Yeah. Thank you, Shanti. So basically, today's topic is on dyslipidemia. As we all know, the one of the leading risk factor or preventable risk factor for cardiovascular disease is dyslipidemia.
Yes.
So if you see nowadays, very commonly many patients come with stroke, the myocardial infarctions in young age. This is particularly attributable to mainly lifestyle modification. So one of which lipids are the one culprit being more of leading on to myocardial infarction. So this is a very important topic, and everyone should be aware of dyslipidemia and how do we manage and how do we prevent cardiovascular disease by controlling the lipids. So we'll continue talk today.
Yes. Very thankful for your great few insight you have provided. Yes. And we do have the great speakers, one from Kumpali, who is Miss Shiva Rani, and Mahalakshmi from Chennai. And yes, going forward, I think, yes, the first slide, yes, Mahalakshmi, over to you. And what you wish to understand from our expertise. Yes.
Good evening to all. This is Mahalakshmi. I am a vice principal working in a nursing college. So as per this today's topic is dyslipidemia. So we have a recent article from the American Heart Association that states in the year of 2026, the heart disease and stroke statistics, a report of US and global data from the American Heart Association, that they have reported the health risk factors, cholesterol and blood pressure, glucose control and cardiovascular and the kidney and metabolic syndromes are more contributing factor towards this. Sir, as you are every day treating, you might be meeting the many patients and treating the patients. We are here delightful to learn from you the statistics data about this, sir. The session is for you, sir. Thank you.
Yeah.
What happens in
So
real life scenario, actually? Yes. You can
most
only tell
commonly,
us.
as Ms. Mahalakshmi said, no, like
Yes.
one thing I told you about dyslipidemia, that is particularly the subset of patients what our population, Indian population get is basically more of LDL, HDL is quite low, and triglycerides are more. So there is one patients. Then next one is the diabetes. Actually, if you see the diabetes is the leading factor for myocardial infarction. In addition to that, they also precipitate cerebrovascular accident and peripheral vascular disease as well, and kidney disease as well. So next one is smoking as well. Then what is the kidney disease, obstructive sleep apnea, and that is or obese patients. These set of patients usually have insulin resistance and abnormal lipid levels again, which will lead to various cardiovascular disease, one being the myocardial infarction. So if you manage or prevent these lifestyle factors and control diabetes well and control your lipids well and stop smoking, avoid sedentary lifestyle, so definitely you'll cut down to some extent to the cardiovascular diseases.
Yes. Yeah, I think a very interesting fact you have provided, and we must know what are our numbers. And as you said, diabetes and sugars and blood pressures and etc. Body weight as well. Yes, let us see what we have in the rest of the session. We are going to keep this session very time bound. Yes. Shivarani, over to you.
Yeah, thank you, ma'am. This is Shivrani. I'm working as a nursing superintendent in CMR hospital. Good afternoon, doctor. Actually, what is dyslipidemia? Is it the imbalance of lipids, or is it any imbalance of triglycerides or HDL or lipoproteins, low density lipoproteins, or cholesterol? Usually, cholesterol as fat in the blood. Like, could you please provide what is dyslipidemia as cholesterol? Is cholesterol like normally? Dyslipidemia or high cholesterol, which can lead to nowadays most of the people are complaining of heart attacks in the small age itself. So, what is bad cholesterol? What is good cholesterol? Can you please give your insight on this?
Yeah. So basically, dyslipidemia as the term indicates, that is imbalance in the lipid levels within the body or the blood, whatever it is. So basically, we have four types of lipoproteins or lipids in the body. One is uh, LDL levels, that is low density lipoprotein, which is called as bad cholesterol in the body. Okay, this is the one which is a contributing factor for all the vascular disease, that is cardiovascular disease, that is myocardial infarction, peripheral vascular diseases as well, and also cerebrovascular accidents as well. Next one is the HDL, where it's called as high density lipoprotein. It is the one called as good cholesterol in the body. The normal levels of HDL is around 40 to 50. Females tend to have higher HDL level till the age of menopause. After the age of menopause, they usually HDL levels comes down. HDL, the only way to increase the HDL level in the body is basically increase the physical activity. So at least brisk walking or running is one important preventive measure to increase the lipid levels, particularly HDL levels in the body. Next one is triglycerides. The normal levels of triglycerides is usually 150 to 200. Basically, to some extent, around 5 to 10% of the time, the contributing factor for cardiovascular disease is triglycerides. Mostly, increase in the triglyceride levels usually, particularly if it is in the range of thousands or 1500, 2000s, these subset of patients, usually they can develop a pancreatitis. So, and high sugars they can present with. The other important lipoprotein, which that we routinely don't measure in our laboratory or routine clinical practice, is lipoprotein A, which is very important. Now, most of the studies are being, even some of them have normal lipid levels, but still they develop myocardial infarction. This is because these patients have lipoprotein A. This lipoprotein A is not routinely measured with what instrument that we use routinely. And suppose if we find this high lipoprotein A levels in the body, these subset of patients can be treated with only injectable anti-lipids that we have in the practice. Otherwise, the statins and other anti-lipids that we use routinely, uh, they cannot target this lipoprotein A levels.
Yes. Yes, going forward, yes. So I just wanted to have my doubt as though you do a lot of interventions in terms of removing this fatty plaque. So how does it look like? Is it look like a waxy type of viscous and sticky substance in the arteries, Dr. Sabrinath?
It's
Just
a
out of my curiosity.
yellowish waxy material itself, but that will not be seen for us in this one. We only see it in imaging actually. We have
Yes.
called as IVUS, intravascular ultrasound, and OCT, which we use. In that, we can see this shining substance and somewhat yellowish color.
Yes, yes. Yeah, that was interesting information. Yes. So what do you, Shiva? Yes, and yeah.
Here these fatty streaks and all, where does it comes from? Usually, is it from cholesterol? Usually, they say from the liver, or how does it? The liver makes about 80% of the cholesterol, or the rest of the cholesterol might be from the foods. How does these liver? Doctor, liver is placed in even in ultrasounds also they show nowadays fatty liver grade 1, grade 2. Is it related to this dyslipidemia or heart diseases? Doctor.
Yeah.
Please give
So, as the Mrs. Shivrani said, no, like the lipids normally, even though we don't consume anything in the diet, our body will manufacture the cholesterol in the body. So 80% of the time, uh, 80% of the cholesterol is manufactured in the liver, out of which most of the thing will be metabolized. Okay, and rest of the thing will be utilized. It may be helping many of the uh, organs in the body require some amount of cholesterol, so that will be consumed. Remaining things will be metabolized in the liver, and uh, it will be washed away from the body. And about 15 to 20% of the cholesterol levels in the come from the foods that we consume. So basically, we try to target this uh, cholesterol that we consume from outside and lower the lipid levels in the body.
Yes. So in case if a client have this fatty liver disease, for example, grade 1, grade 2 and all, so Is it difficult for the client to metabolize his cholesterol also at the same time, Dr. Shabrina? Maybe
No, usually they don't have a defect in the metabolism. They have a tendency to accumulate lipids, particularly these triglycerides in the liver.
in
So
the
basically,
liver.
that will give the appearance of shining appearance when you do ultrasound in this set of patients. So these
Yes.
patients, definitely, one thing is you should lower the lipids, particularly the triglycerides. Weight reduction should be there. Physical activity, that is sedentary lifestyle, should be avoided.
Yes, very interesting, session which we are trying to learn is, yes, over to you, Mahalakshmi, and yeah,
Yeah.
thank you.
Sir, I just want to know about the signs and symptoms of dyslipidemia. Usually, if you see the high blood pressure, also the patients were not aware about the symptoms, like similar to the dyslipidemia. The patients are not aware about the symptoms which they have present. So, how come the patients are coming to you with the symptoms like if they have like obesity in the sense they will feel that I have a high cholesterol level, like that they are coming to us, or they used to come for regular visits to find out the signs and symptoms of this dyslipidemia.
So usually, dyslipidemia, most of the time patients usually does not present with any cardiac symptoms or any other vascular disease symptoms. It usually keeps on accumulating over a period of years, and suddenly one time, when this cholesterol plaque is there, that when it gets ruptured, suddenly you get a myocardial infarction. So how do you diagnose this? So most of the time we advise routine regular checkups for this subset of patients, where we do lipids in the body, then sugars, then we also check the ECG, echo, and stress test, that is a treadmill test. So when any one of these, and one more thing is coronary artery calcium scoring. So
Calcium.
if anything is abnormal, this subset of patients, we usually have increased risk for myocardial infarctions. So routinely we usually regularly follow this treadmill test and other tests to diagnose the early heart diseases, and prevent major consequences.
Yes.
Thank you for the clarity,
And
sir.
yeah.
So what about the risk role of this statin therapy? So the risk factors like genetics in the family history, uncontrolled diabetes mellitus, hypothyroidism, metabolic syndrome, insulin resistance like PMOS, and then the PCOS clients. Nowadays, if you see the young adolescents girls also, they all are positive with the like 10 and 9 students were positive with the PCOS. So how come that we can elaborate with the lipid profiles?
Yeah. So basically, the genetics play a very important role in the cardiovascular diseases. Like it tends to run in some of the families. Some patients, young age people, they come with the myocardial infarction. If you ask them, either their mother or father or immediate blood relatives usually tend to have a cardiac disease, particularly at young age. Then and family history, the same thing. Uncontrolled diabetes, I told you, diabetes is one of the important and major contributing factor for vascular diseases. So diabetes should be initiated very early treatment, and it should be very aggressively controlled in the initial stages to prevent the long-term complications. Hypothyroidism, usually these subset of patients usually have increased amount of triglycerides in the lipids, and to some extent increase in the LDL, and HDL usually does not affect. So if you control thyroids, these subset of patients does not require any medications. And metabolic syndrome and insulin resistance or obstructive sleep apnea, or all these subset of patients, basically they have overweight or obesity, where they have more often related to insulin resistance. Insulin resistance which is a contributing factor for abnormal levels in the lipids. So basically they have low HDL, high LDL, and increased triglycerides. And some people, even though they are not obese, even thin people also, they have high levels of LDL. That is because of various other factors that
Yes.
come into play. And females, I told you, till menopause, LDL levels and
Yes.
HDL tend to be high. After the menopause, the HDL level drops and LDL tends to increase, and that is why most of the time myocardial infarctions tend to occur in after the age of 45 or 50 in females. So basically, the important dietary factors are, most of the time people are addicted to fast foods, particularly now, like fries,
Yes.
burgers, pizzas, and all processed foods. These things to be avoided, and
Yes.
to make your lifestyle healthy.
Yes. So
Yes, sir.
as I go with your say that yes, sedentary behaviors like HDL, which is again considered as a good cholesterol, which normally helps clear bad cholesterol, as We are just listening from your discussion since the past 10 minutes. Yes. And you said about the gender and smoking and alcohol behavior also to be limited or quiet. So yes, and yes, I think yes. So Shiva would like to ask about this factor, which is again you said most of the time smoking also, but yes, and then yeah.
Yeah, how does this cigarette smoking affect the heart? Is only the smoking one of the important cause in the heart attack or in the young patients? Recently, even we could hear that athletes, those who don't have the smoking habit, also they have the had heart attacks, all that. So, is there importantly is the cause only the cigarette smoking or anything else where it makes the blood to clot in the arteries or anything where we need to concentrate?
So cigarette smoking, basically what it does is there are multiple ways it can cause myocardial infarction. One is they can cause vasospasm of the coronary arteries, so that will reduce the blood supply and may produce myocardial infarction. The next one is this the toxic substances that are present in the smoking. They can cause the endothelial the damage of the endothelial lining. Once this endothelium lining gets disrupted, these lipids and the RBCs and platelets, everything they tend to accumulate there and can precipitate myocardial infarction. And the other thing is the LDL levels tend to increase, particularly at the site of myocardial infarction,
Yes.
resulting in myocardial infarction.
Yes, yes.
And yes, I think Mahalakshmi, Dr. Shabrinath has already told about this child myth versus fact. Yes, apart from yes, over to you, and then I think we are just approaching to the nearest, nearing to the end of the
Sir, I
discussion.
have a query on it. Lipoma and xanthoma. So how we are approaching this lipoma and xanthoma?
Yes.
Yeah. So I didn't get you. Can somebody tell me?
Lipomas.
Lipomas.
Lipomas and xanthoma. Yeah.
Xanthoma.
Okay, lipomas are nothing to do with cardiovascular disease. Basically, they are the fatty swellings present beneath the skin. They can be present anywhere in the body where fat tissue is there. So they usually benign conditions. They usually very rarely, they does not progress actually to malignancies, and they are not related to any lipid levels in the lipid abnormalities in the body.
Thank you, sir.
Yes, and how frequently one should go for screening? Maybe a gender, male or female, after 35, or what is your tips for them? How frequently they should do this screening?
So basically, we usually start screening quite early, 25 or 30 years. We usually screen with routine tests like lipids and a treadmill test and echo. And you can get a coronary artery calcium score if required. And if any abnormalities is there, we can do CT coronary angio. And CT coronary angio, once you do, usually till 5 years, there is no progress in the disease, or we say that he's free from disease for 5 years.
Okay. So there is
Doctor,
nothing. Yeah. Please.
what about these postmenopausal patients? Do they have need to go regular health checkups because postmenopause
Yes, madam. They
more
require regular
frequent
checkups after
for
the age
this
of
or more
45
prone
years.
to have these cardiac diseases, as you said?
Yes, like as I told you from your other
Oh,
population,
okay.
this
Okay.
post-menopause also women tend to needs to, one thing is in addition to doing lipids, and we also regularly screen them for vaginal cervical cancer like pap smear,
HPV and
and
all.
breast
Yes.
cancer is one important thing. We do mammography or ultrasound of the breast to detect any hidden malignancies.
Yes.
Thank
Yeah, I
you.
think this was a very quite, brief session. You have provided us a lot of, very crisp point. Yes. And I urge all the viewers to just refer www.yashodahospitals.com for more health academics, and also watch patient testimonial for virtual and evidence-based learning. Yes, we have seen Dr. Shabrinath presenting a lot of the other topics, like why would somebody should need a pacemaker, etc. And remember to keep your heart health safe. And with this discussion, I end the session, and I thank you, Dr. Shabri. Quite though you're busy, but you have contributed your valuable time. I thank you, Shiva, and I thank Mahalakshmi as well. Thank you. We end the
Thank you,
session.
Shanti. Thank you all.
Yeah.
Thank
Thank
you.
you. I thank Yashoda Hospital for giving me this opportunity. Thank you.
Thank you.
Thank you.